welcome back to our next episode of the Hormone Café. I'm Dr. Sarah Pederson. I am a holistic OB-GYN, and I specialize in women's health and fertility. And I have our nurse practitioner here, Emily. She also specializes in holistic women's health and fertility. And it's perfect. It works out perfectly because she just had a baby, sweet Ella. So we wanted to do a whole series on postpartum and really dig into how to prep. And so today we really want to focus on postpartum self-care, because we do a lot of research on the baby and the baby's health. But here, of course, we care about everything, the whole family unit, mom, baby, husband, everybody. We want everyone to feel amazing at all times. So the 8 things that we wanted to go into today are sleep, partner support, vaginal and perineal health, breast health, nutrition, exercise, sex, and then what to expect with your periods. So we'll go over all of those different things about how to keep yourself healthy. We're going to start with sleep. I think that's almost the hardest one sometimes.
Definitely.
But how would you describe maybe just set up someone's expectations about what the sleep is like? And then how do you ensure that you actually get sleep?
Yeah, this is something I honestly knew very little about going into having a baby. I think especially when you work on the women's health side, you are very educated on mom and what to expect postpartum. But I talked to a lot of families that had babies recently, and they and they shared with my husband and I just some tips. So you can expect those early weeks, especially, to be waking up every 2 to 4 hours overnight to feed your baby. They are going to need to eat every 2 to 3 hours typically during the day, whether you're nursing, formula feeding, all of that. And you usually will have to set alarms in the beginning. Every pediatrician and their recommendations are different, so definitely talk with your team. But that is what we were recommended to do probably for the first 3 or so weeks. And so it is a lot of broken sleep. You definitely can sleep in those little stretches, maybe for 2 hours, 2.5 hours at a time, and then set an alarm, wake up, feed the baby, change the baby, put him back to bed, rinse and repeat. And so that's what the first month looked like for us. I will say, I really believe that as women, we are designed to withstand that. It's very, very difficult. But as someone who pre-pregnancy had to sleep 9 hours a night to feel like a normal human, I was shocked at how much easier it was than I expected. And this is coming from someone who did not have a baby with colic, and so I'm really thankful for that. But I really think something shifts when you have your baby, so don't be too scared about it. It also doesn't last forever. Usually, for us, at least at that 1 to 2 month mark is when our baby started sleeping through the night. So currently, she's 3 months old, and she sleeps about 10 hours straight at night, which is such a gift. Not everyone has that. But that's kind of what the first couple months typically look like.
Sometimes I feel like when you get anxiety if your baby is snorting or you're worried about them turning over.
Right.
How do you actually get sleep?
Yeah.
Because sometimes the tendency is to just watch your baby and make sure they're still alive and they're breathing.
Totally.
And then by that time, you have to feed them again.
Yeah. So babies make a lot of noise in their sleep. And that is a tip that one of my friend's husbands gave us, that he was like, I know it sounds crazy and you're going to hear these weird noises, but that's normal. Like, they're going to talk to themselves in their sleep. They're going to snore, all of that. We do a bedside bassinet, and there's obviously lots of different ways to approach baby sleep. Some people co-sleep, some people have a full-blown nursery with the baby in the other room. Do your own research on all of that. Room sharing is what's recommended by the American Academy of Pediatricians for the first year, I believe. So I think just making informed decisions about safe sleep is really important. But for me, as someone who does have some baseline anxiety, having her right next to us really helped me. So I haven't struggled too much with that. But in those early weeks, I definitely would roll over, put my hand on her belly and be like, okay, is your chest rising and falling? Are you breathing?
Yeah.
So you're just going to have to know yourself and know what would make you feel less anxious. And obviously, partner support, trading off at night if you're able to, can really help you get more sleep.
Yeah, I feel like that is huge. Sometimes that felt like when the baby was in our room, just like could not sleep.
Yeah.
And then as soon as I knew my husband took her outside and rocked her, I was like, okay, yes, I can actually sleep.
Yes.
But it's true. Even 2 hours, you'll feel like a new woman.
Oh, yeah.
When before you needed 9.
Totally. Yeah, trading off helped us so much. I mean, there'll be points too. I mean, we could talk about relationships, marriage, all of that, where you're going to get some like partner resentment, I think, at night.
Sure.
When you're like, oh my gosh, he's sleeping and I have to wake up and nurse the baby. And I mean, my husband and I had some funny conversations at 3 a.m., but that's where the good communication really comes into play. Like, what are our expectations, especially as your husband goes back to work, maybe before you do? You know, does he need to get more sleep? Yada, yada, trading off all of that. And also not being afraid to change up what you're doing too. I think helps such a good point. Because baby's constantly changing and their sleep is constantly changing.
And when it's 2 a.m. and they're crying and your husband's just sleeping peacefully in bed, you can build up some resentment. So that it's important to just be aware of, have open communication.
Totally.
Have boundaries so that you're on duty, he's on duty. It's just clear. So that you have at least set times when you feed baby, he feeds baby, that kind of thing.
Absolutely.
Yeah, sleep is big.
It's huge. Yeah, we can talk about that for a while.
Yeah, second thing I wanted to touch on, which makes sense, is like partner support.
Yes.
How important is that? Is there some the conversations you should have ahead of time, that kind of thing?
Yeah, I think just expectations, like we talked about in the last episode, and then also with sleep, is just really good communication. I think that's probably my biggest suggestion just for like pregnancy, postpartum wellness is partner communication and making sure y'all are on the same page. There's a lot of different strategies, especially when it comes to sleep of, okay, someone takes a shift from 8 to 2 and the next person is, 2 to 8 or something like that. And it's hard when you're breastfeeding because you're the one supplying the food for the baby. You can also pump, but then you have to get up and pump, and it's just a whole thing. But talking about that when you're well rested and not at 3 a.m.
Such a good point.
is huge, so that you can just prevent arguments, miscommunication. I really enjoyed our birth prep class that we took at Swedish Hospital. I think it was the last session, was all about postpartum care, and they split us up into men and women, and we all came up with like what would help us just have good postpartum self-care, all of that, and then we shared with the other group.
A good idea.
It was great.
It's really cool.
It was great. So it was just a big brainstorming session, and Justin and I got a lot of our ideas from that of, okay, we're not going to talk about anything serious in the middle of the night when we're deprived.
Essential.
We're going to trade off. We shifted things when he went back to work, and I wasn't back to work yet, so I took more of the night stuff when he was getting up at 4:30 to go exercise. So there's just a lot of knowing yourself and your schedule.
And just communicating what your priorities are is huge. If you're a person that you just want to do 15 minutes of yoga every morning, you want to make sure your husband can watch, you feed the baby, your husband can keep an eye, even if it's before work, so you can have a little mom time, take a shower. Yeah, that is huge. Yeah. And just changing it up.
Yeah.
I feel like with our first baby, my husband was always the one who changed the diaper. Yeah. And I would breastfeed. Yeah. And then I feel like with our second baby, we had more of a, I'm on duty from this time to this time, that he's on duty from this time to this time. And you're right, you just have to see kind of what works.
Totally.
And what makes sense as long as it's clear.
Yes, absolutely. Like, there's no right or wrong way to do it. It's just what works for your family.
And with everyone's work schedules too, you want to make sure everyone's getting some sleep, everyone's participating, everyone can function during the day. Yes.
Right.
And then one big thing that I feel like I had no preparation for is everybody tears. Yeah. Maybe not everybody, but most people tear. And you just have no idea. Yeah. And then now your vagina hurts so bad. You can't even sit down. Tell me about your even just like patient experience with that or personal experience, like what to expect. How do you care for your vaginal health postpartum?
Yeah, I feel like you actually prepared me well for this because I didn't have a lot of experience on the postpartum side of things as a nurse and NP. Mostly was like labor delivery, immediate postpartum, like, okay, send you on your way. Of course, we're going to be in pain right after giving birth. Well, unless you have epidural or pain meds, you're going to feel much for a bit. But yeah, I tore and it hurts. And the soreness is something I didn't expect. It kind of feels like you've been sitting on a bicycle for a long time, and it just sitting down, even getting in bed, it can be a lot. And so I would get probably 3 times as many ice packs and pads as you expect. I had a very sweet, generous friend of mine give me all her extras. I still have some. So if anyone needs that, let me know. But I mean, those ice packs are your best friend. I would sit on ice, witch hazel, Tux pads, all the things that you hear people talk about. Get it all, register for it. It's huge. But just like moving around as much as you can and just finding comfy positions, pillows. Not to scare anyone, but it does hurt. But it will go away. It took a few weeks for me, though.
Yeah, it's just something you don't really anticipate.
No. Yeah.
I think one thing that really helped me that I needed to make myself do is actually take the time. Because in mom world, we're focusing on baby sometimes.
Yeah.
Like, or you're just like, I can't even eat or take a shower.
Yeah.
The last thing you're going to do is take care of a wound sometimes.
Mm-hmm.
So I think personally, I really had to say, Sarah, you need to take a sits bath.
Yeah.
Every day you need to sit in the bath for 15 minutes.
Yeah.
I also had a really bad tear, like deep vaginal tear, but it was so bad. I'd never tried so much ibuprofen in my whole life.
Yeah.
And just even taking the time literally on the toilet to do exactly that. Like your witch hazel, your Tux pads, your perineal bottle, like almost having the expectation that you need to care for yourself in that way.
Yes.
And have a second where you're not on baby duty or not baby sleeping.
Yeah.
Because that is something I didn't expect that to take up so much time.
It's a lot of time. Yeah. I have a little basket. We still have it now, even though I don't need it. It's like with your witch hazel, your peri bottle, all of it in there. So you can just grab it really easily. And if you're in a home where you're using multiple bathrooms, like having little stations was really
a good idea.
Yeah. And then having someone watch baby while you're doing that. Because you might be in the bathroom for 10 minutes peeing and then doing all of that. Also, having a bowel movement for the first time after tearing can be really scary. I had one of my first in a Starbucks bathroom. And that was very intimidating. So just be prepared.
Like, how long can I be in here before they
try tense, but not tense. It's just a whole thing.
That's a good point. Bowel function is huge.
Yeah.
Sometimes taking a stool softener, something like that is important to recognize.
Yeah.
And then breastfeeding is very important. We'll do a whole episode on that. But just in kind of briefly, how do you take care of your breasts postpartum?
Yeah, I think one of the most helpful things, I had a lactation consultant friend of mine who is out in North Carolina. We did a little pre-pregnancy, or not pre-pregnancy, pre-birth FaceTime call. It was actually the day before I got induced, ironically enough.
Good timing.
Yes.
Thank you
so much. She said you need to move your milk every few hours. And that concept of moving milk was really helpful, whether it's latching and breastfeeding, pumping, hand expressing. You need to keep milk flowing to prevent getting clogged ducts, mastitis, all of that. It's just, I think breastfeeding can get really, really complicated because it is such a science. And the timing of pumping and latching and troubleshooting all of that, if you can just focus on moving milk, whether you're breastfeeding or not, or just pumping, whatever you're doing, you need to get milk out to prevent it from just staying there and getting engorged. I got so engorged at the beginning, which can be very normal as your mature milk comes in, but it's very alarming the changes your breasts go through. So don't be scared to ask for help. Try to move milk as much as you can. And I think it gets so much easier after the first month.
Did you have to use anything like nipple butter, creams, anything cold?
Yeah, I think another big thing to remember is if it's painful, that's not normal. It's going to be uncomfortable starting out, but I had a couple weeks where I was crying while breastfeeding because it was so painful, and that was not normal. So we had a lactation consultant come to our house, and she fixed everything, but I used a lot of the nipple cream. I think it's like the Lanoche or something brand. It's like lanolin.
Yeah.
I went through so many tubes of that stuff. It's really, really helpful.
So did you put it on before and after breastfeeding, or just
before and after?
Okay.
Yeah, it's safe to be in the baby's mouth, but yeah, usually mostly after, probably.
And sometimes I feel like you have to buy a couple brands and just see what you like, which might sound a little wasteful, but sometimes there's certain things that just work better for your skin and your baby, and just having it accessible, almost like you said for the perineum, having a little station of like mom care when you're breastfeeding.
Get a rolling postpartum cart. You probably saw it when it came to our house. We got it from Amazon. It's great, and then you can have all your little things and have them within arm's reach because you're not going to be wanting to walk very much for a little bit too.
Yeah, and if you don't have it within reach, you might not do it. You might get dry and cramped.
Right, because you're like holding the baby and trying to reach for your stuff. And
yeah,
it's really helpful.
And I think, too, the concept of getting help, because sometimes you think, I don't want to show anyone my boobs. This is embarrassing.
Yeah. Modesty goes out the window once you have a baby. I will say that. The second you have a vaginal birth or a C-section, it's like, whatever.
Yeah. I remember going to a lactation consultant, and I was like, help me.
Yeah. Yeah, I mean, there's so many great resources, especially in the Denver area. There's really wonderful people who are really passionate about this stuff. And just like we see vaginas all the time, and it's like not a big deal. It's same to them with breasts. So
when in doubt, ask a lactation consultant friend.
So we've had multiple visits, and oftentimes they're covered by insurance too. So
yeah, it's great. And then the other thing is nutrition.
Yeah.
Obviously, in our holistic fertility and women's health and pregnancy world, we focus a lot on nutrition. What would you say is important for your nutritional status after you have a baby?
Yeah, so many things. And of course, everyone's different. You know, like for me, I lost a lot of blood in my birth. And so I had to really focus on iron because I did have some anemia. So, you know, red meat, leafy greens, all of that was really helpful. I really think, especially if you're breastfeeding, you can easily underestimate just how many calories you need.
Oh my gosh.
We've talked about this.
So true.
It is.
Yes.
Breastfeeding hunger is crazy. I mean, and it will regulate, but just getting nutritious foods as much as possible, but like calorie-dense, nutrient-dense foods like chilies and really hefty sandwiches and, you know, oatmeal with a bunch of peanut butter, just really dense things that still are nutrient dense are really helpful. Smoothies. I've had my husband make me these like intense smoothies with protein powder and peanut butter and oats and stuff. You know, yeah, again, if you're breastfeeding, having, you know, foods that help promote adequate breast milk production, so like oats, things like that. That was a big shocker to me. I just didn't realize how starving I would be all the time. I mean, I was eating Pop-Tarts at 3 a.m, trying to like keep my hunger at bay. And
yeah, you just require so many calories and so much water in order to breastfeed and build your hormones back.
Really part of. Yeah, even if you're laying in bed all day, breastfeeding and sleeping. I mean, I've never been hungrier in my life.
And I think it's one thing that your journey is not going to be like anybody else's journey.
Yeah.
Because I remember people used to say to me, oh, I lost so much weight after because I was breastfeeding. Breastfeeding is a great way for you to lose weight. And I remember thinking, I have no idea how people lose weight. I feel like I want to eat the fridge. Like I've never been so hungry.
And you need to eat the fridge when you're breastfeeding.
For sure.
Keep up your supply. It's hard.
And to your point of eating just meals is huge because otherwise if you snack, which is great, you know, that might work for your metabolism, but you might realize that you're not getting enough calories to sustain you as much as you would need.
Absolutely. And you'll, like, it's going to be trial and error. Like, I've gone through both ends of that of, oh my goodness, okay, I'm nourishing myself really well, or I feel really depleted in some way. Like, you'll feel it. You'll feel fatigued and maybe more irritable, or maybe your supply will dip. And you're like, okay, I need to really prioritize nutrition more.
For sure. Yeah. And I think that concept of just getting a diverse variety of things, like having your protein and your vegetables and not just always reaching for something that has much sugar or carbs or that kind of thing. So just always keeping it balanced is huge.
I feel like that helps a lot with the lack of sleep piece too. If your nutrition is really good, I find that it helps you just feel better when you can't really control sleep too much.
That is true, because if it's 6 a.m. and you're like, I've been up all night long, if you can eat a breakfast, that really helps set you up for success for the day.
Totally.
What about exercise? I feel like sometimes people want to get back into exercise right away, or they're afraid. What did you find your exercise introduction experience like?
I'm in the middle of that right now, so I'm just hit about 12 weeks postpartum, and usually around your 6-week mark, if you've had a vaginal birth, you'll usually get cleared to exercise, you know, have your stitches if you had them checked. I think it's more like 8 weeks for a C-section. It just kind of depends on what that process looked like for you, your birth. I mean, I definitely wouldn't recommend like jumping into something super intense. Typically, you can go on walks and do like light stretching, yoga type stuff before getting cleared. But definitely holding off on like running and weights and all of that is what's usually recommended. For me, I was a runner before pregnancy and then really took a break when I was pregnant. And so I've been slowly getting back into running and some weights. And honestly, it's helped so much. I feel so much better.
And stronger.
Yes. And you will get so much strength from holding your baby and the car seat and the stroller and all of that stuff. You have a new appreciation for your body, for sure.
I think one thing I was surprised about is that I started running and I was leaking urine.
Yeah.
And it's one of those things where you're like, oh man, I hear about this, but I've never ever leaked urine.
Oh yeah.
And I really found that I had to focus on my pelvic floor.
Yep.
And you hear about that a lot, but you sometimes don't exactly know what it is. But I had to go to pelvic floor physical therapy because I just don't naturally think about my pelvic floor, focus on it until I really needed to. So that I thought was really helpful for me, is focusing on not just contracting it, but relaxing it to strengthen.
Breathe appropriately. I'm in pelvic floor PT right now. I've been doing it for about 6 weeks because an interesting symptom that I didn't think about, because you hear about leaking urine, but also excessive gas is another thing too, because you think of your whole pelvic floor and you have, your urethra, you have your vagina, you have your anus, and all of those muscles are controlling the opening and closing of those different openings to our body, and one of them is our GI tract. And so sometimes we can have excessive gas that you aren't able to control. It's kind of like leaking urine, and that was a bigger symptom for me than the urine piece. Pelvic floor PT is amazing. It's so wonderful.
100%.
It's
highly recommend.
Agree. But especially if you're exercising, you're like, oh, I'm leaking urine or I'm passing gas, and this isn't my normal. Like, those things aren't normal. So definitely don't feel like you have to live with it.
Yeah, I think one thing to know is that it isn't normal. So if you have that, please reach out to your doctor, provider, pelvic health, or floor physical therapist, because there's lots of things we can do to help that.
Yes.
So that's not, because sometimes we normalize some of that things, like, everybody leaks after they have a baby.
Like, that's weird.
Right. Like, exactly.
Yes, but also no. Like, it's normal because it's common, and it doesn't mean it's normal to live with that forever.
For sure. Yeah. Can get you back to feeling really great every day. And then the last couple things we wanted to touch on is sex and periods. Sometimes, depending on how you felt during pregnancy, people have obviously different relationships with, did you have sex in pregnancy or not? And then postpartum, now it's totally changed.
Yeah.
How do you talk to people about that?
Oh my goodness. I feel like this could be so many episodes. It's such an interesting topic. I mean, again, I think it goes back to partner support and communication. I mean, you and your spouse, your partner, you guys have your sex life, and that's very intimate to you, and it can be hard to talk to a professional about that too. But I mean, we care about that. We care about helping you with it. It's a huge part of your life and your health, and it's really important. I don't think people realize just how much that can change in pregnancy and postpartum with hormone fluctuations, libido changes, and then of course, like, body changes as well. If you've had a tear, that can be really scary. There's a lot there. So just managing expectations, especially, with your spouse as well, and talking about, what's medically recommended, but also knowing it might take you longer to feel comfortable having sex again. So just all those expectation setting conversations, I think, are really important.
Yeah, and even things like having non-sexual touch and still having a relationship, because once you have a baby in the middle, it can be really hard on your relationship as a couple. And so even having even if it's not date night, having a little date time where you're focusing on each other, even with your baby there, I feel like helps with that. And just doing even like snuggling and cuddling, because sometimes that kind of goes out the window when you have a baby. Yeah. And then if you're just jump right into sex, it can feel very exactly. Yeah. And I think a lot of communication about how you're feeling is important too, because sometimes it's like you're spilling milk, your nipples are hurting.
That's another thing. Yeah, I mean, oxytocin, letdown, but also orgasm, and so you can have oxytocin surge in different settings, even thinking about your spouse or about your baby, and then all of a sudden you'll be leaking milk. And so talking about that is really important.
Yeah, and just saying like how you're feeling, what feels good, what doesn't feel good, what feels low, and setting kind of those expectations that it might be completely different than your pre-pregnancy body, that kind of thing.
Absolutely. Something that was really helpful for my husband and I, just in like talking about intimacy in general, was something a pastor told us in premarital counseling, was when you have a baby, the mom can feel out-touched sometimes. Like physical touch has been you and the baby. You're doing so much physical touch with your baby that sometimes you just don't want to be touched by your partner, and that can be really normal. It's more of an expectation setting with the man, but that is a really helpful concept to realize, like, maybe I'm getting all my physical touch from this child, and maybe that's why intimacy doesn't sound as appealing postpartum. So yeah, those little touches with your spouse, like holding hands, kissing, all of that can be really helpful.
Or even just vocalizing, like, I need a hug right now, or I really just don't want to be touched. Totally. Like, is that okay if I just have my little space?
Absolutely.
Yeah, that's a good point of just knowing what you need and being able to kind of say that is huge.
Yeah.
And then lastly, periods are kind of tough.
Yeah.
For 9 months, we had a break from periods, and it was so nice. We put our tampons away.
Yeah.
Then when does your period come back? Well, how do you expect that to look?
Yeah. Yeah, it really depends on your hormone profile and also what feeding is looking like for you. So you often hear about, if you're breastfeeding, you'll have a period. It's not exactly that simple. It really depends on your prolactin level. Prolactin will suppress ovulation when prolactin is high enough. And that's, the hormone that has to be high enough to make milk and then allow us to breastfeed with oxytocin as well. Once you introduce solids around 6 months, that can get tricky as well. Typically babies aren't getting all their nutrition from food at that point. They're still relying on breast milk or formula. But that's all to say, it can be complicated. I mean, usually if people are weaning around a year or so, that's when you'll probably start to ovulate again and have a cycle. But from my experience with patients, it really depends.
So variable.
But if you're consistently exclusively breastfeeding during that time, you are likely not going to be ovulating. But everyone's different. You can have random breakthrough ovulation. It just depends on your levels.
Yeah, and some people get their period back in 2 months.
Right.
Even if they're exclusively breastfeeding.
Yes.
And some people don't get their period back until they're completely weaned, which could be 2 years, depending on how long you breastfeed.
Totally.
What does the first period look like?
Yeah, it can be very different from your regular periods. It might be lighter, it might be heavier. It just really depends. Your body hasn't shed a lining in quite some time. The last time you've been bleeding was after birth. So from my experience, patients, it's just been very different. It's always a really good time to check hormones too when your period comes back, because you can bleed but also not be ovulating. And so just teasing that out with your patients, especially, with family planning and all of that, is really helpful.
Yeah, and I think sometimes they can come out of the blue, and that's okay.
Yeah.
I sometimes just will.
Yeah.
Which is just another fun part of exciting life of being postpartum.
Yes.
Well, thank you so much for all of your amazing personal insights. It's so great. And thank you for joining us today on Hormone Café. We just wanted to review with you some of the self-care things postpartum. So if you're planning to have a baby, you're currently pregnant, you're postpartum, you want to go over any of those things with us, please give us a call or look us up at verafertility.com and make an appointment. And then our next episode is going to be on breastfeeding, one of the huge important things also with regards to postpartum in our postpartum series. So thank you again for joining us, and join us on the next episode of the Hormone Café.